here.
Well, welcome back to the second lesson on dental occlusion for the team, where we're looking specifically at muscles. And so as we look at the continuum from the new patient exam all the way to treatment planning, that diagnosis section is of the function, and of course the part of the exam we're looking at is obviously the muscles. So let's take a closer look at the muscles. When you look at this list of muscles that we here at Spear Education are teaching to examine, it looks like a long list, and it can be a little bit overwhelming. And it is for the dentist too. But as for the team, what I want you to know is I don't want you to have to identify the origin or insertion of all the muscles or really have a deep understanding of exactly what they do. I think it would just be beneficial to have an appreciation of why we're doing the exam and maybe just where the muscles are, because maybe you've never heard this before. So let's go through the muscles in a sequential order. So let's start with one of the big muscles, which is the temporalis muscle. And as you see here, it goes over the side of your head, and it really is almost as big as your hand. If you put your hand on the side of your head, that really encompasses almost your whole temporalis muscle. And its job is actually to elevate the mandible. It's to squeeze the lower jaw up to the upper jaw. And what I want you to see is that it also has a tendon that inserts so basically it's taken this whole fan of a muscle and bringing it down into this one big strong tendon that inserts right into the mandible. So you can imagine that all that force can lift the mandible up, and it's a strong player in occlusion, one of the strongest players in occlusion. And when we palpate the temporalis, we actually break it down into three areas: the anterior temporalis, the middle, and the posterior. And again, I don't need you to understand exactly why we're going all the way back, but it's nice to break it down because it's such a large muscle. We do need to break it down into three areas. Before we move on to the next muscle, I want to take a minute and talk to you about this whole palpating the muscle thing. Why are we palpating the muscle? What are we looking for? And one of my favorite analogies is going to the gym, right? Because our muscles are there for work. And so when you go to the gym and you're working out, you are trying to develop muscles sometimes or grow muscles sometimes. Or even if you're not going to the gym and you're just walking, your muscles are always developing. And so if we overuse them or our muscles are not working in harmony, something else is going to happen. And I like to talk about occlusion in muscles in this way. Whereas if say you're a clencher or a grinder, and that means, and say you're a nighttime bruxer, let's say, and you're really working your muscles at nighttime, and that's the same as going to the gym. That's the same as going to the gym and say using a dumbbell. Say you're trying to get your biceps big and you're trying to curl a dumbbell. Well, they're working at the same time together, first of all, let's remember that. But one of two things is going to happen at the end of a good strong workout. Your muscles are either going to get bigger because you're using them, and that happens. And if you're overusing them or they're not working in harmony with one another, they might actually be sore. So when we're palpating muscles, really one of the things we're looking at is, are they sore because they are working in dysfunction? Are they sore because they're being overused? Or are they just big because they're being used a lot and they're not quite sore yet? So when we're palpating muscles, we're looking at all those things. It's not just if it's sore, is it big? Or is it big, or is one side different from the other side, or are they sore from overuse? So as we move from the temporalis down to the back of the neck, which is a common way we do the exam here, now we're on the back of the neck, I'm not going to spend too much time talking about the posterior neck muscles, but you'll hear us talk about the suboccipital muscles, or the splenius capitis, or the paracervicals, and the trapezius. And really, again, these are all down the back of the neck, as you can see from these photos here, and they don't seem to be too integrally related to function, right? Except they're all actually connected to the skull, which houses our top teeth. And or, when you think about what we do with our posture during the day, and when we lean forward just a little bit, it changes our jaw a little bit, Or if something is sore, say our back is sore and we're always turned one way, it can affect our bite a little bit as well. Or vice versa, if we don't have a real good bite and we're always trying to bring in some other muscles to try and brace, then a lot of the back or neck muscles might be sore. So that's the reason we're doing the examination on these muscles. And if you find that there are a lot of occlusal interferences, then really we always want to do the examination on the muscles. Or it's funny, which came first, the chicken or the egg? Sometimes what we find is we do our muscle exam and there's a lot of soreness there, and we're not surprised when we look in the mouth to see that there's a lot going on occlusally that might be causing that. So sort of which came first on those. But when we talk about the neck muscles, the deep neck muscles, or the trapezius in the back, it may not seem really closely related to occlusion, but yet there's a reason we're doing the exam. As we start to work our way back up from the back muscles and the neck muscles up from the sternocleidomastoid, we end up right here at the floor of the mouth, or the digastric. And that's an interesting muscle that I think it's nice for the team to know about, because its main job is actually to support the jaw when it's open. So it's a stabilizing muscle. So in other words, when we come, it doesn't really open the jaw per se, but when it's open, it helps stabilize it, and it helps open it a little bit. So what I want you to think about is it's opposite of the temporalis. The temporalis brings closed. The digastric forms the floor of the mouth, and it helps just sort of stabilize the mandible when we open and help open it just a little bit. As we work from the floor of the mouth, we're right back up here to our other real big squeezing muscle called the masseter. And that we have a superficial masseter and a deep masseter, but what I really want you to see is that's our other real big squeezing muscle that elevates the jaw. It works with the temporalis, the first one we talked about, to help guide the teeth into proper position. It actually comes down the outside of the mandible and wraps around the corner of our mandible. So again, it's this big old sling that helps bring our jaw together. And as we palpate that, we oftentimes work up and down it, and sometimes find the deep masseter to see if there's soreness there. But again, as we're palpating that, and you as a team sitting there right now, you should, if you do, you just bite on your back teeth and squeeze. And again, you can really feel, and what I'd like you to feel is not only how big your masseters are, and you might even compare with the rest of your team if you're with your team, and if not, check with them next time you see them. And also feel, does one side flex before the other side when you bite on your back teeth real slowly, or do they flex at the same time? And think about going to the gym. This is a great muscle to talk to patients about, with the correlation of going to the gym and what's touching first or second, and how the muscles are working in harmony with each other. So those are the muscles of mastication that are extraoral. There are a couple of other muscles that you'll see your dentist palpate from the inside. One of them is the medial pterygoid. And this muscle is pretty cool because it is actually sort of like the masseter in that it helps elevate the mandible, but it's on the inside. And sometimes you might be wondering, when the dentist is doing the exam, why is their finger all the way back there in the corner of the mouth? And as you can see from this photo here, it's a difficult one. You can't palpate it from the outside, so we're going all the way back to palpate it. But really, it's the same as the masseter. It's a big old muscle that works exactly the same as the masseter, except it's on the inside of the mandible. In fact, on this photo that you see here, so basically you're standing inside of the mouth next to the tongue, looking towards the lingual aspect, and you can see it just goes right up and down just like the masseter, except it's on the inside of the mandible. So now we've got three big elevator muscles, right? We've got our temporalis, our masseter, and our medial pterygoid. That's a lot of force bringing a mandible together. So you got to wonder what happens when one of those is out of whack, or when they're not working in harmony with each other, or some of the other muscles, which we'll get to. And so speaking of muscles not working in harmony with other muscles, this is one of our favorite muscles to talk about that you've probably heard in the practice a lot, and that is the lateral pterygoid. The reason it's talked about a lot is it actually, as you can see, it runs horizontally. So all the muscles we've talked about so far are ones that go vertically to bring the mandible together, and this one actually runs horizontally. And its job is actually to push the chin out, or to protrude the mandible. That's its main job. Or when we move our jaw from one side to the other, right? One side has to release and one side has to flex. And so the lateral pterygoid has a lot of side-to-side work. It also, interestingly enough, is attached, one little part of it is attached to the little piece of cartilage in our temporomandibular joint. So this darn lateral pterygoid is an instigator of a lot of funky function, if you will, and also has a lot to do with what might happen with our disc in the temporomandibular joint. But again, its job is to pull the mandible forward and also help it rotate when we're going from left to right. And so really, you can see how quickly we made it down the list of the muscles of mastication. You look at the list and it seems so long, but a systematic approach to evaluating them and just understanding sort of what they do. You know, you got your elevators, you've got your muscles, your supporting muscles, and then you've got your protruders and openers in there. And if we just think of that, we can appreciate the reason we're doing the exam. And now as a team, if you're wondering what they look like or where they are, you can always come back to this lesson and take a quick look at the muscles and see what they do and where they are in the human body. So I hope this lesson's been helpful, and I'll see you at the next lesson.